Greetings, everybody. This is Dr. Adam Rindy, and welcome to the next episode of the One Thing podcast. Today's guest is Dr. Lucy Melling, who has her PhD in Nutritional Sciences from the University of Illinois. She's also in their MD program pursuing the clinician researcher route. She has a special interest and focus in the GutSkin Axis and also in utilizing the Autoimmune Paleo diet to help address chronic inflammatory conditions. In today's episode, we are going to go into the gut-skin axis and how the gut influences skin disorders such as acne, rosacea, psoriasis, and eczema. It's a very interesting episode that we talk about how potentially the gut is causing skin inflammation and what we may do to help manage skin conditions through gut balance and other interventions. Hope you enjoyed the episode, and thanks again for tuning in. We'll jump right into the episode with Dr. Melling. Okay, so I'm here today with Dr. Melling, and she's going to speak to us today about the gut-skin axis, and we're going to kind of jump in and welcome you to the show. So welcome very much, Lucy, for being here today.
Thanks so much for having me on.
You're welcome. Very excited to speak about the gut-skin axis, and this is a topic that I know you've dove deeply into, and I'm curious if you could just share with us briefly about how your interest in the gut-skin axis came about.
Yeah, so it was really what led me down a much healthier path in life. So I grew up with severe eczema for most of my childhood, and it really wasn't until I was about 19 or 20 in undergraduate that I came across some information about the connections between gut health and our diets and skin health, and really started to take a deep dive into that. And the more I learned and the more I experimented with my diet, the better my skin started to get. And it wasn't really until I, started diving into the literature and really focusing on that I saw improvements in my own skin health. And that's what inspired me to also help others in this realm and to do research in this area as well.
Mm-hmm. So what have you learned so far?
So really, it was learning. There's not a lot about the gut-skin axis in the literature. It's growing, but it's a lot of smaller, lower impact journals. We're starting to see the gut-skin axis pop up, and more people are looking at how skin conditions are associated with an altered gut microbiome or gut dysbiosis. So there's definitely these connections that are there. And yes, I definitely saw it empirically in my own self. It seems that, of course, changing my diet was really having an impact on my skin. And of course, what mediates that connection is our gut microbiota and our gut immune system kind of mediates that interface. Obviously, there's definitely connections between the nutrients we eat are making up our skin as well. Mm-hmm. But there's a lot of connections in terms of the gut microbiota and the immune system are really mediating that interface.
Mm-hmm. Let's talk about that interface. So is the interface at the gut barrier that is sort of where we would begin this discussion, or is it elsewhere?
Yeah, I think, there's definitely layers above, the gut barrier. So for example, having adequate stomach acid is really important for shaping the composition of the gut microbiota, and having low stomach acid is something that is seen commonly in skin conditions. But certainly the gut barrier is kind of that key, interface that seems to be disrupted in almost all skin conditions, seem to be associated with permeability of that gut barrier. And, it's really only a single layer of epithelial cells that separate the contents of your gut with your bloodstream, your immune system. So maintaining that gut barrier is really, really important to maintaining health. And essentially what happens is what we're seeing is with skin conditions, that gut barrier breaks down and we're getting an influx of dietary antigens. So, large food proteins getting across the barrier, activating the immune system, and also potentially bacterial toxins getting into the bloodstream as well and activating not only the gut immune system, but systemic immunity as well.
Mm-hmm. Yeah, so it's, I think people intuitively know or have seen going to a dermatologist for a condition like rosacea or acne and be given an antibiotic and told something like doxycycline,
Mm-hmm.
well, this is likely to help your skin, and it, in a lot of cases, it does. And so, so it leads to the next question: Are we treating dysbiosis, and the after effect of that is that the skin is improving because of it? It's always sort of a question we have these days. Or is it
right? Yeah.
Antibiotics? Is an antibiotic actually targeting something in the skin organ?
Yeah, that's certainly possible. I think when you're talking about something like doxycycline, you're talking about quite a large hit to the gut ecosystem. And I do think that, a lot of people do see acute benefits from taking antibiotics. And this is true of gut symptoms as well. You see a lot of benefits for people, who have SIBO type symptoms, often go along with rosacea as well. And you see when they take oral antibiotics, it does seem to get better, both the GI symptoms and the skin for a time period. But almost always there seems to be a relapse. Mm-hmm. And that's really because it's not addressing the underlying causes, and actually taking antibiotics may be, further exacerbating the problem, even though it does provide symptom relief in the short term. Mm-hmm. It may stress the gut epithelium and also reduce the diversity of the small intestinal microbiome over the long term.
Mm-hmm. Okay. And, so we're learning a lot that the skin has, well, pretty much the whole body has its own unique subsets of microbiome, right? These days it's not just the gut, the skin, the lungs have a microbiome. So given the assumption that the skin has its own set of subset of microbiome, can we just walk through sort of the steps? So let's say there's a breach in the intestinal barrier, and food antigens are obviously coming into the diet. It could be just your everyday normal healthy foods that we wouldn't think twice could be harming us. Mm-hmm. So there's this breach in the intestinal barrier, and then potentially there's cell wall debris or inflammation from the gut microbiome breaching this intestinal barrier like you alluded to. And then, so now let's say the breach has been made. Can you just draw the connection between, at that moment, how the skin may become inflamed? Is it through certain channels like lymphatics? I've just always been curious, like what the mechanism is exactly, if we know at this point. Maybe we just don't know.
Yeah, so there's a number of potential mechanisms, and it's really interesting because it may be a combination of all of them. There was a 2011 study that found that when you have those activated gut immune cells, they can actually be reprogrammed and migrate to the skin if you have some kind of exposure on the skin that's similar to the exposure that occurred in the gut. So they're definitely, at least this has been shown in animal studies that they've shown that then that can elicit an allergic immune response in the skin that shortens your skin lipids and reduces your skin barrier function. And then from there you get more exposure, from antigens from the environment on your skin, and a larger, essentially exacerbated skin immune response. There's also, the skin also on basically the underside of your skin, the part that faces your circulation on the underside, also has receptors. There's TLR4 is a very common one that some people might have heard of, that binds to a compound called lipopolysaccharide, and that is endotoxin, which is primarily derived from the gut, almost exclusively. unless you have a leaky skin barrier. Then you may also get some leaking in from the skin as well. But essentially, you can have, if you have a leaky gut and you're getting this LPS from the gut, translocating into the bloodstream, it can then activate those receptors on the skin and produce a skin immune response.
Amazing. So, okay, well, that definitely draws a connection. And so the Western medicine model of taking something like a biologic for a condition as serious as, really severe psoriasis is working along that mechanism as well, it sounds like, as far as immune modulation.
Yes, definitely. Definitely, if it's taken orally, it is working along that mechanism. It's also possible that there does also seem to be skin to gut communication as well. So there was a really interesting study where they found that if they chemically induced psoriasis in mice, they actually found altered immunity and gut microbiota composition in the gut. So there is bidirectional communication as well. It's not just gut to skin, it's also skin to gut. So it's also important to be sure that we are addressing the skin barrier as well, because a leaky skin ongoing can also potentially contribute to impaired immunity in the gut.
That's a great point. We're seeing this bidirectional relationship between the gut and other organs pop up, like gut brain and gut endocrine, and it's quite fascinating that you could influence the digestive health by having a barrier breach in your skin. It's fascinating. The skin is the largest organ in the body. Is that correct?
Yep.
So, and people don't realize that it's actually considered a separate organ. And, people who haven't gone through like medical school might not even think of it that way, but.
Right.
So.
Right. Yeah. And.
Yeah, go ahead.
Oh, I was just going to also mention that, a lot of food sensitivities can also start in the skin. A lot of people don't realize that. But that's another example of that bidirectional communication, is that when we're exposed to food antigens via our skin, especially when we're young, before we're exposed through the oral route, essentially what you have is you have these cells in the skin called Langerhans cells, and they're especially good at sensitizing the immune system. So if you're exposed to, for example, peanut dust in the house, through your skin, through a leaky skin barrier, then you can have sensitization, and that can in turn lead to a food allergy when you're later exposed through the gut, because you've already been sensitized to the skin. And there's actually a really close association between, for example, eczema and peanut allergies, and other food allergies as well. So that's another really interesting bidirectional pathway there. Yeah.
Wow, that is fascinating, because those early moments of life when you're kind of rebooting, or actually just establishing your flora, and the skin to skin contact is one of the main ways, like being connected to your mother or your father or caregivers, I'm sure has a big influence of the diversity of the microbiome in those early moments. And
yeah, definitely.
I think it's, one of the things I'm seeing recommended a lot more these days is that actual skin contact with a newborn. It's good that we're seeing that plays such a role in the immune system. Well, so this situation, as a researcher, when you think about this, I mean, obviously from a pharmaceutical standpoint, the mind can kind of start thinking of all these different ideas of the way to address this problem. And a lot of them seem to be out there, but, and what's overlooked is the gut and the microbiome, and maybe it's thought about, but you're actually really doing things and thinking deeply about what we can do from a standpoint of maybe addressing that LPS signaling, it sounds like, and also addressing how to reduce the amount of dietary antigens that might be triggering this inflammation. Can you go into some of these like applications that you've seen to perhaps decrease some of that inflammation driver that you're talking about?
Yeah, certainly. So, I mean, really, it's coming back to maintaining the gut barrier and trying to strengthen the gut barrier. And, you know, we can certainly talk about different supplements and, you know, things that people are very interested in that they can just take and, you know, seal that up. But it really, I always stress that it really starts with the major pillars of health that, you know, we all talk about in integrative medicine, which is, you know, getting the diet, healthy diet, exercise, sleep, and stress management is really key to maintaining that gut barrier. Beyond that, there's definitely some extra things that can be helpful for support. So for example, glutamine can be really helpful for repairing the small intestine, and butyrate for the large intestine. Those are kind of the primary fuels that are used by those gut epithelial cells to turn over, proliferate, and maintain that seal. But, you know, those are also things that we get from our diet. So, so really it comes back to trying to heal and seal up that gut barrier. For a lot of people, you know, getting rid of inflammatory foods in the diet will be enough to improve their skin condition. So a lot of the, you know, for a lot of people, grains, legumes, dairy can be really inflammatory to the gut. And those are kind of represent some of the most common food sensitivities as well. I often also find that for some people, taking it a step further and going to something like the autoimmune protocol diet can be really beneficial for a short period of time to identify different food sensitivities. Because essentially, once you have that gut activation of the immune system to these various foods, you kind of have to get the foods out that are causing the most inflammation for a short period of time so that you can kind of bring down inflammation, really get the gut to a place where it can repair, and then you can kind of often reintroduce those and you won't have the same sensitivity to them after the gut barrier is repaired, and there's not that same ability for the immune system to directly interface with the food antigens that are coming in. So we're actually working on a study right now to look at the effects of the autoimmune protocol in eczema and psoriasis, and we'll also be looking at the gut microbiome and gut barrier function and how that changes with the intervention. So that's kind of it's a comprehensive diet and lifestyle intervention, but it's focused on the autoimmune protocol. So that's kind of my first general approach, is to really look at the diet and lifestyle components and make sure those are sorted out, because that's gonna be the biggest thing that moves the needle in terms of, you know, we can look at all these nitty-gritty pathways and try and find some place to intervene, but you know, it really starts with those pillars of health. And then, you know, for those people who have those in place and are still experiencing symptoms, then we can certainly try and, you know, go to a more reductionist approach and find things that might specifically target some of these pathways.
Okay, so basically, like the common skin conditions such as rosacea, acne, eczema, psoriasis, this is where you would start for all of the above conditions. So sort of just looking at the gut barrier, looking at inflammation drivers in the diet and in the microbiome. That's kind of like your pillars.
Yeah, definitely the pillars that seem to be common across skin conditions. There do seem to be some, you know, there's definitely nuances for the different skin conditions. For example, with acne, a high glycemic index diet really seems to contribute to acne. So I'd also focus on blood sugar regulation with acne. And dairy intolerance seems to be really big for acne. Hormones can also play a role there, so I might also look into there, but in terms of the gut-skin axis in acne, it's really looking at the glycemic load dairy proteins in particular. Rosacea is kind of more of a mixed bag. Usually we do see, for a long time it was thought that rosacea is closely associated with SIBO. Now our whole concept of SIBO is really changing in the last few years, and a lot of those studies were based on culture, meaning that we kind of need to re-evolve our thinking around SIBO, and I'm hopeful that we'll see more studies that are looking at the small intestinal microbiome and things like rosacea and acne that were originally tied to SIBO, but now, it may just be more small intestinal dysbiosis or potentially, maybe carbohydrate malabsorption in the small intestine that are contributing most of those. And then when we're thinking about eczema and psoriasis, it seems to be more of almost like an allergic inflammatory phenotype. And in that case, food sensitivities are really big. Histamine can be particularly implicated in those. So histamine is a important immune signaling molecule, but often tends to be particularly high in folks who have eczema and psoriasis. And a lot of that is derived from excess histamine production in the gut from an kind of a dysbiotic gut community producing too much histamine. And then of course stress is huge, especially in honestly in all skin conditions. That kind of gets back to there's bidirectional communication between the gut and the skin and the gut and the brain, but there's also this gut brain skin pathway whereby stress is mediating changes in the gut, and that's affecting the skin.
Yeah. And I want to talk a little bit more about that in a bit, because I also want to just mention that having a skin condition is an extremely emotional quest, as far as there's a lot of emotional health issues that can arise from having a skin condition, as far as anxiety, depression, and just having stress over skin eruptions and social appearances. And so that's
absolutely.
I want to get your thoughts on that in a little bit, if we can. So, okay, so we sort of at this point, I'd love to hear your assessment tools, because back in the day, we would just sort of assume maybe this is going on, and we would just start by treating the gut and potentially supporting the body. But now we have new tools to help us with making more precise recommendations or tracking our progress. What's your take on some of the tools, and which ones do you like to use when addressing this problem?
Yeah, so I really do like to do comprehensive stool testing is probably the major one that I like to look for in terms of gut or skin conditions. I was using GI Map. I'm currently reevaluating new options that are using metagenomics, because I think the field is moving this way, and the metagenomics has the potential to be much more accurate and is coming down in cost significantly. So that's essentially where they basically grind up all the DNA in the fecal sample and are sequencing everything. So they're getting down not only to the genus level, which is what a lot of other tests are doing, but they're getting down to the species and the strain level. They can also look at yeast, parasites, archaea with a great degree of accuracy. So currently reevaluating new options, especially in the wake of some changes with some of the stool testing companies. So I'll have more to announce in that regard soon. But that's kind of what I'm moving towards. And I do find that useful because, there are a lot of people who, they have all the diet lifestyle in place. They're still really struggling with their skin condition. And in that case, comprehensive stool testing can sometimes identify things like parasitic infection, yeast infection, or just, severe bacterial imbalances that are potentially contributing to their skin condition. And treating those can be really important to restoring gut health and skin health.
Okay.
So that's kind of the major one. And then I also like organic acids testing as well, since this can essentially give us a window a little bit more into the small intestine potentially, because this is essentially looking at what gut bacterial products get across the gut barrier and into the urine. And so we can sometimes see some overgrowth that we wouldn't see with stool testing, because the small intestinal microbiome is way different than the fecal sample. So that's also sometimes helpful to look for yeast overgrowth or Clostridial overgrowth.
Mm-hmm. Okay. I didn't hear you mention anything like leaky gut testing, such as lactose mannitol or zonulin tests. Are you using any of those as well?
Yeah, so the lactulose mannitol test, I think is great. It's the gold standard for assessing intestinal permeability, and I do use it in my research studies quite a bit, where we're trying to show that an intervention does improve, the gut barrier function. In an individual that I'm working with as a client, I don't necessarily find it useful because it doesn't tell us why the gut is leaky, or it doesn't really give us any actionable information other than telling you your gut's leaky, which is likely when you have someone come in and they have a skin condition, it's almost guaranteed that they have some degree of intestinal permeability. So having a number to it, unless it's going to motivate that patient more, unless it's going to motivate that person, or you really want to track the ability of a certain intervention to heal up the skin, or heal up the gut barrier. I don't find it useful, especially when, a lot of times for functional tests like this, where, it's already coming out of the client or patient's pocket. So, so I kind of prioritize the comprehensive stool testing, organic acids testing, and, like a full blood panel, before anything like the intestinal permeability testing, even though I think it's very useful in the research setting. As for zonulin, I've seen quite a few studies that call into question whether it's clinically useful. So there's definitely a lot of fluctuation in zonulin levels even throughout the day that's been shown. So some question as to whether measuring zonulin antibodies is more stable and a more clinically accurate picture of what's going on. So I am not typically a fan of zonulin just because there seems to be a lot of variability. Certainly, if you got a zonulin result and it was off the charts, that's probably indicating that there's, an issue going on there. But, it seems to be too variable to use it to track anything useful.
Yeah, that makes sense. And then, since we'll get into the AIP in just a little bit more, but if someone sort of is in the food intolerance camp, are you doing anything with food sensitivity testing? Or are you more doing that through elimination diet kind of approaches?
Yeah, great question. So the elimination diet is definitely the gold standard for determining food sensitivities. So that is typically what I recommend. If someone is unwilling to do an elimination diet, then I might consider food sensitivity testing. But I always kind of take the results with a grain of salt. So it might identify particular things that you could, think more or be more aware when you eat those foods, am I potentially being triggered by this? But then you have the whole placebo effect with food intolerances as well. So, so it's a little bit difficult to know. I don't generally start with food sensitivity testing. I usually go with the elimination diet over that if possible.
That makes sense. And your elimination diet is more along the lines of what? Just basically implementing like an AIP, Autoimmune Paleo protocol, or do you do like a structured elimination diet with more group than the AIP?
No, typically I would have someone start with a paleo template diet first, because often a lot of people can see, especially if they're starting from the standard American diet, often just switching to, a nutrient dense paleo type diet can be enough to reduce skin conditions. If that's not enough, and it seems like food sensitivities are likely, then I would probably do an autoimmune protocol type diet. I've seen that to be most useful. There's a lot of resources around it as well, which makes it a little bit easier to implement. And also personally, I tried many different diets for my eczema, and I found the autoimmune protocol to be extremely helpful for me personally. And so I also have, my personal experience with it that helps me to aid clients through it. And then of course we're doing this study with it, and for the study I've teamed up with Angie Alt, who runs Autoimmune Wellness. She's got a lot of experience with AIP, and even has put a lot of folks with eczema and psoriasis through it and seen a lot of benefits for it herself. And so now we're trying to show that with peer-reviewed research. So there's certainly other elimination diets that could be helpful, but I found that the autoimmune protocol seems to work well for a lot of people.
Okay, so let's talk about what the autoimmune paleo diet is, and also how it works and why it works.
Yeah, so it's essentially, so it removes, like paleo, it removes dairy, legumes, refined sugar, grains, but it also removes eggs, nuts and seeds, nightshade vegetables, caffeine, alcohol. I think I got everything there. So it removes some other foods that are potentially inflammatory to someone who has severe gut inflammation. And it's not intended to eliminate all of those things forever. It's essentially kind of to give you a clean slate, allow your gut to heal a little bit, allow your skin to respond to that healing. And then you essentially systematically reintroduce foods to assess your response to them. Once you kind of have that clean slate, you're much more able to assess your response to each of these food groups individually.
Okay, and I imagine that time frame is different for everybody. It's like it's flexible as far as how you move along that continuum.
Yes, definitely. So some people just do about 6 to 8 weeks on the autoimmune protocol, sometimes 10 to 12, and then proceed to reintroduction. Other people are finding that they really get symptom relief on the full AIP protocol and end up staying on it for a longer time. So actually, myself, I ended up on the full autoimmune protocol for about 7 months before I started intervention, but I was starting from a place where I had about 80% of my body was flared with eczema when I started the autoimmune protocol. So if that wasn't the case, maybe I would have been on it for a shorter period of time. And I typically see people don't need to be on it for that long before they can start reintroductions, at least of some of the foods. You might, through that process, you might find that eggs are a particularly bad trigger for you. And so you might say, I'm not going to eat eggs for the time being, but I'm going to reintroduce other foods. So it really helps you to diversify your diet as much as possible. It's not intended to be restrictive for a long period of time. It's intended to have you go through this reintroduction process so you can assess your response and diversify the diet as much as possible while still managing your symptoms.
Yeah. And so your study is going to be looking at the microbiome changes that take place while someone's on this plan.
Yes, exactly. So we've got baseline, essentially what their microbiota was at the beginning, and we'll also see how it's changed at the end. And we're also doing that lactulose mannitol test before and after to see how gut barrier function resolves, in addition to looking at symptoms and compliance and all that kind of stuff.
That's wonderful. Yeah, it's and I haven't heard you mention anything like interventions with antimicrobials or plant-based, prebiotics or anything like along the lines. You're kind of keeping it pure with diet, or are you doing other interventions?
Yeah, so for this study, it is comprehensive diet and lifestyle, but we're not introducing any supplements to the protocol. So it does have some lifestyle components, helping them with sleep, stress management, exercise, these kind of things. The diet is really core to the protocol.
Yeah.
But we do kind of emphasize a different lifestyle factor each week. But yeah, I mean, I think there's great potential to layering on some of these other things. So potentially herbal antimicrobials, prebiotics, supplemental like oral probiotics to the protocol. For this one, we're just really focusing on, what the diet and lifestyle can do. We didn't want to introduce too many variables to the research, even though, it is a comprehensive lifestyle intervention, but we wanted to show that, the diet and lifestyle could really make an impact. And
That's
potentially
wonderful.
in the future, we could do a study where we kind of layer on some other aspects of integrative medicine and show what that can do for someone with a skin condition.
Yeah. I mean, I think it's the majority of people, I think, if it fits within their diet and their lifestyle to reverse their condition, they prefer that versus having to rely on a supplement or a pill or something. So it makes sense for you to see, like, foundationally how far you can go with pure diet and lifestyle changes. That's great. So before we leave this topic, we didn't get into discussing, or I haven't heard you mention anything topically for skin gut disorders. What's your take on topicals? And I'm not talking about like prednisone or, like corticosteroids or but just sort of topical support.
Yeah, so topical support is really important because, as I mentioned, if we have a leaky skin barrier, we're going to be causing disruption in the gut as well. So it's always really important to address both sides. For topical support, I generally suggest if you wouldn't eat it, don't put it on your skin. There's a lot of cosmetics out there, a lot of products marketed for eczema, psoriasis, acne that are really potentially doing more harm than good because they're just putting toxins into the body. They're just, they're overloading the liver. They're potentially interfacing with the gut. So if you, I certainly, if you're in a place where you have severe skin issues and you really need, a corticosteroid in the short term to bring that down, then by all means, I think it's important that we use that when it's necessary. But if you can manage it with topicals like coconut oil based products, I have some other topicals that are kind of more plant and oil based that I like to use. But essentially, anything that you put on your skin, you should assume that it's interfacing. It's probably getting it. If you have a leaky skin barrier, it's probably getting into your circulation, and it's potentially interfacing with your gut as well. So, really important to use more hypoallergenic products that are ideally not chemical based.
Yeah, that's interesting because I'm thinking about the topicals that I sometimes use with people who have skin disorders. Like one of them, for example, is like calendula.
Mm-hmm.
Calendula has a lot of properties that you would also use for gut imbalances. So it has demulcent properties. It's lightly antimicrobial, and it has one of these like entourage effects that you would think about with herbs, or it has anti-inflammatory properties.
Right.
So that makes a lot of sense, and it's a good way to think about it. And it's also interesting, like with fungal issues, a lot of people are using like coconut oil topically,
Mm-hmm.
and lauric acid, we know, which comes from coconut, is strongly antifungal. And coconut's used in a lot of bases for skin products.
Mm-hmm. Yeah.
It's an interesting way to look at it. I've actually never looked at it that way, and that's really eye-opening for me. But it's nice to know that it's been happening, and we're in some ways without even knowing that's a core concept. So one of the things I'd love to hear from you as someone who's had eczema, sounds like really severe eczema. What's the impact emotionally, and what can you share with someone who's out there who's suffering from a skin condition? I've had patients over the years where it's such a journey, and it's almost like it's hard for them to express what it's like to people who don't have skin problems. I'd love to hear what you could share.
Right. Yeah. I think it's a really important topic, and one that definitely affects everyone a little bit differently. I was fortunate when I was younger that it was primarily like on the inner sides of my elbows, backs of my knees. So it wasn't that noticeable, and it wasn't something that other kids usually noticed or picked on me about or anything like that. But towards high school, it started to get around my mouth, and I would have to I didn't know any better. I put on Vaseline, probably 30 times a day. And then in college, it started to get all over my hands, especially, and over my eyes and around my mouth as well, quite badly and noticeably. And it was certainly around then. I'd been kind of fortunate up until that point. My eczema had always been a bother, but it wasn't really something that ever really got to me. But, once it was on my face, and definitely, affected my outward appearance, and at that time, it really did affect what I thought of myself, and was really hard to get through that part. And that is when I really started to say, I've got to look at other options. Mm-hmm. And actually my older sister, knew it was really starting to get to me, and suggested that I look into diet more, because she kind of jumped on the paleo bandwagon a couple months before that, and was getting really interested in diet and health. And she suggested to me that I start trying to make changes. And that was what really motivated me, was that I was starting to experience a lot of, negative feelings about myself because of the eczema, and I felt like it affected how other people saw me, and that was definitely really hard, and was really important to realize that there were a lot of other parts of me that people liked, and I didn't have to worry about that. So it was definitely a very difficult time. And it definitely helps me relate to other people as they're going through that and experiencing that.
Yeah. And, I think also, people get to a point where, they do go to the extremes of treatment, because there is a lot of desperation. And I think it's good that you're out there saying, well, maybe this is something you could try before you go to higher force therapy, or what have you. Or a conjunction. There might be some better outcomes.
Yeah, and I'd also say that part of it is really, like, it really does kind of force a journey towards self-acceptance, and I think that's a really important part of the healing process, and actually not one that I totally even found until after I had cleared my eczema. So I would say that I was quite hard on myself in terms of what my skin looked like for a long time. And it did motivate me to do these diet and lifestyle changes and to get better. But it wasn't, I would say I didn't really achieve full solid remission until I'd addressed some of the psychological baggage, for lack of a better word, that had come along with that entire journey and having to go through that. So, I think it's really important that, that people with skin conditions do have some mental health support as well, because it can definitely affect the healing process.
Yeah, it's really great to hear you say that the self-acceptance came first, or the process of self-acceptance and you tried to address that first, even before your skin, maybe came along with more improvement, because, I guess people with health conditions throughout their life, or changes in their appearance, self-acceptance is it's a key component of healthy aging and just healthy that we experience in life. So that's really remarkable that you did that. And I think it's a really healthy message. So thanks for sharing that. So before we conclude here, maybe you could give us a few take-home messages on this topic and the GutSkin Axis, or anything that you'd like to share just to kind of leave us with, and then to hear you share more about what you're up to today and how people can follow your work or get involved with some of the projects you're involved with.
Sure. Yeah. So first, I would just say I think it's really important for everyone to know that there are other options out there for treating skin conditions. It's not just what your dermatologist can offer. There is great potential for diet and lifestyle to make huge changes in skin conditions, and I encourage people to explore diet and lifestyle aspects more. Really work on managing stress, getting that self-acceptance and that mental health piece is really important. Getting social support is really key. And if diet and lifestyle isn't enough, then look into addressing potential underlying gut pathologies. So find a functional practitioner who can help you to identify whether you have fungal overgrowth or parasitic infection going on, because addressing those can really make a huge difference in your skin health. I really appreciate the opportunity, Adam, and I hope this was helpful to people.
It was helpful, and I'm sure I learned quite a bit from hearing you take us through from the science perspective and then the application perspective. So thank you. And and can you just share how people could keep in touch with you, follow you, or get involved with some of your research?
Yeah, so people can find me at ngmedicine.com, nextgen.ngmedicine.com. I actually have a free 60-page ebook on the GutSkin Axis on my website. So you can check that out. It's got pretty much all the research we talked about here kind of laid out in more detail, along with testing and treatment strategies, supplements, diet and lifestyle interventions that can help with skin conditions. So I'd encourage everyone to check that out. And then you can also support my work on Patreon. Our research study is already ongoing, so we were really grateful to everyone who helped crowdfund our study for that. We're hoping to set up a nonprofit so that people can contribute to future research. But for now, you can support my work on Patreon or find me on social media at NextGen Medicine.
Great. Well, thank you for your time, and I look forward to following your work down the road. And sounds like you're really doing some great things for people. So thank you.
Thanks so much, Dr. Rin.
Thanks again for tuning in to today's episode with Dr. Mailing on the GutSkin Axis. Hope that you enjoyed the episode as much as I did. Please share this episode widely with your friends and family and loved ones. Get this word out there. There needs to be more information on how to treat skin conditions. Right now, I see many people just being offered topical corticosteroids, and the latest in the dermatologic world is to attempt a series of biologics for skin conditions. From my view, it's very important to at least intervene on some level in the way that we spoke about today, whether it's an anti-inflammatory diet or elimination diet, but also looking and assessing at pathobiont drivers coming from the gut. And the basics still apply, of course, with good old-fashioned topical care, skin, protecting the skin barrier. And there's a new category called topical probiotics that we need to pay attention to. We have so much more to think about than just sort of suppressing the inflammation. What is going on here that's caused the breach? What's going on here that's activated the immune system? There's areas to think about from above down, from the skin surface down. And obviously through talking with Dr. Mailing today and through the research that we've started to see come out in the literature, there's a lot going on from below, meaning the gut barrier region, that could be driving this. So how do we bring this world of internal medicine to the world of dermatologic medicine and bring these two worlds together and help manage these conditions a little better? Are wanting to feel better, wanting their skin to appear better, and oftentimes are betting on the outcomes for. So I think this is a really important topic, and I hope that you learned something, and I hope you can share it with your loved ones. I would say, any type of functional medicine doctor that has been tuned into gut health can help you with your skin condition. Also looking through the Autoimmune Paleo community for people who are focusing on dermatologic issues. There's a lot of support on the Autoimmune Paleo diet. It's just one of many potential approaches. And functional medicine, naturopathic medicine focused providers that have a special interest in skin, gut, and brain disorders could be helpful too. Thanks again, and we'll talk to you next time on the One Thing Podcast.